Hello ladies and gentlemen, and thank you for attending this presentation. Today, I'll be discussing postoperative pain, in particular current practices and processes for assessment and management. We will have the opportunity to analyse what is being done, what works, and what could be improved to provide better patient outcomes. So, what is pain? Pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. It is important to remember that pain is what the person says it is and exists whenever the person says it does. From these definitions, it can be deduced that pain is an extremely subjective experience, and therefore the most important relevant assessment of pain is the patient's self-report, and this must be taken into account along with the whole presentation of the patient, including baseline measurements, comorbidities, mental health status, previous experiences, and expected outcomes, as the experience of pain has a significant impact on an individual's quality of life and their ability to carry out activities of daily living. Postoperative pain assessment and management continues to be a challenge within the healthcare system, with around 50% to 75% of surgical patients reporting experiences of moderate to severe pain postoperatively. Assessment of an individual's pain postoperatively is a fundamental and crucial step in developing a patient's pain management plan. Despite this, nurses continue to inaccurately assess and determine a patient's pain level postoperatively. It has been suggested that this inability to assess accurately occurs due to a lack of awareness of the importance of assessing pain, as well as a large sense of confusion and inconsistencies in assessing pain, which may be a result of Australian local guidelines and policies not being readily accessible. A local policy directive that was located for the measurement of vital observations does not mention the assessment of pain, despite the American Pain Society recommending that pain be considered as the fifth vital sign and assessed during a full set of vital signs in order to continuously monitor, assess, and adapt to a patient's pain. Despite the evidence available, management of postoperative pain has also continued to be inadequate over the last 20 years with minimal improvement. The inadequate management of pain is evident in the statistics, with at least 50% of patients still experiencing moderate to severe pain 24 hours postoperatively. Unrelieved postoperative pain is a cause for major concern, as it can delay a patient's healing and may also lead to chronic postoperative pain. The Royal College for Anaesthetists has set best practice standards for postoperative pain control. However, these standards are not always met in practice due to the challenge of finding efficient ways of implementing them. Local guidelines for day procedures sets out a criteria that must be met, requiring patients to have adequate pain control before they can be considered for discharge. Patients must also be provided analgesia for discharge to continually manage pain. However, it has been reported that 10 to 14% of patients did not find relief from the analgesia provided, and 20% of patients did not receive their medication on discharge. The goals of postoperative pain assessment are to identify and implement appropriate pain management by describing the patient's pain experience and to identify the patient's goal for therapy, as well as resources for self-management. There are many tools available to assist health professionals with assessing pain, including self-report and observational or behavioural tools. Some of the best evidence-based pain assessment tools available are the Verbal Descriptor Scale, Visual Analog Scale, Numerical Rating Scale, Abbey Pain Scale, Flack Pain Scale, and Wong-Baker-Faces Pain Rating Scale, as approved by the Australian Department of Health. Following an accurate assessment, it is essential to adequately manage the identified pain based on severity and type. There is evidence to suggest that the best way about post-operative pain management is enhanced recovery after surgery pathways, protocols for enhancing post-operative recovery, procedure-specific pain management or PROSPECT, and multimodal analgesia, in particular non-opioid alternatives and non-pharmacological interventions such as relaxation and music. The challenges being faced by nurses in assessing and managing postoperative pain are the numerous interventions available to do so, and attempting to find the most appropriate and effective management strategies for their patients. There are also gaps in current research to support the use of multimodal analgesia. Despite the evidence for its effectiveness in pain management, no combination has yet been identified as the optimal solution. There is also limited evidence to suggest what method is most effective for perioperative patient education. A lack of knowledge or understanding and training of nurses has also been identified as a challenge to achieving good pain assessment and management. The research has identified a need to improve post-operative pain assessment and management in order to improve the outcomes for these patients. Despite the challenges, there are strategies that can be used to improve the assessment and management of post-operative pain. There needs to be a greater awareness of pain and the implications it has for the patient in regards to their health outcomes. This can be targeted with education and training, like this, for nurses and other healthcare professionals. Policies and protocols also need to be written up and made more accessible in order to create consistency across assessment and management on a ward, as well as implementing guidelines for selecting the most appropriate tools and interventions based on a patient's needs. This, combined with training, will increase the knowledge base of clinicians, effectively reducing time spent attempting to decide which tools and interventions are most relevant, creating a quality system that ensures best practice care. In addition to this, regular audits should be utilised to monitor and evaluate the outcomes of post-operative pain assessment and management. In assessing and managing post-operative pain, practitioners should better utilise the acute pain service to ensure comprehensive and continuous post-operative pain management. Evidence has suggested that involvement of the patient in their perioperative journey is fundamental in improving the outcomes of surgery. This should include involving the patient in self-management of their pain, as well as perioperative education for the patient so they have a better understanding of what to expect post-operatively. This has been proven to reduce the severity of pain, however further research is required to determine the best method of perioperative patient education. In summary, pain is a major side effect of surgery and if left unmanaged can lead to severe health outcomes for the patient. Therefore, accurate assessment and effective management of a patient's pain post-operatively is imperative to their healing and recovery. As discussed, evidence suggests that assessment and management continues to be inadequate and regarded as insignificant. This is due to numerous challenges that must be addressed and can be overcome using evidence-based strategies in order to ensure the best assessment and management of a patient's pain and recovery post-operatively. Thank you for your time and attention today.